Breaking news, the Department of Justice has just filed a complaint accusing 3 of the largest health insurers of paying illegal kickbacks to major insurance brokers in exchange for steering patients into insurers' Medicare Advantage plans. The DOJ accusing CVS's Aetna, Elevance Health, and Humana of paying kickbacks to brokers. eHealth, GoHealth, and SelectQuote. The Justice Department said that rather than acting in an unbiased manner and in the best interest of patients, the brokers directed Medicare beneficiaries to plans offered by insurers that paid them the most in kickbacks. And of course, this only underscores that the healthcare industry clearly needs a transformation. Listen to this.
You've got this huge technological shift that we all think about all the time around AI. What that's leading to is a fundamentally different kind of an opportunity. We will obviously have founders start new businesses that are innovative, but the big opportunity is how do you transform existing businesses? So in that context, a whole new set of companies need to be created that enable that transformation of these industries.
So that was General Catalyst CEO Hemant Taneja on the Claman Countdown Monday, highlighting how new companies are utilizing the power of AI to revolutionize existing sectors. One of the better examples of this company that has successfully transformed a historically problem-plagued sector is Waystar. The healthcare payments company was the biggest healthcare and software IPO of last year. Raised $1 billion, and the stock has soared 90+% since it started trading on June 7th. The stock is moving even higher right now on a strong earnings report where the company beat on revenue and raised its full-year guidance. Joining us now in a Fox Business exclusive, Waystar CEO Matt Hawkins. Matt, very impressive, but even more impressive is one part of what you are transforming, and that is figuring out how to deal with patient denial claims, which have been ridiculously high. The insurance companies, it's almost like they're rubber stamping, deny the claims. And that's horrible for doctors and patients in many cases. How is what you're doing at Waystar fixing that?
Well, good afternoon, Liz. It's an exciting time to be doing what we're doing. Thank you for recognizing our share price performance and the importance of our mission. We have a strong business model, and we've delivered 4 consecutive quarters of double-digit revenue growth and adjusted EBITDA margins as a public company, a rule of 50 type business. And really, it's because of the strength of our business model, the importance of our mission to address this really cumbersome manual work that goes into providers as they interact with payers. Oftentimes they get those claims denied. We're helping bring software to bear on that. We're bringing automation to bear on that. And it's a statistical fact that there's nearly $500 billion of waste that occurs in the United States every year. A lot of that can be bucketed in the category that you highlighted, denied claims. 450 million claims get denied every year, and providers are spending over $20 billion a year to tackle this problem.
Yeah, and by the way, the process to appeal a denial is onerous and almost ridiculous. They almost make it so hard that you give up, you throw up your hands, you say, fine, what am I going to do? Either not get the procedure or I'll just pay it. And that's not the way this is supposed to work. The patients and the people who are insured are not ATMs that only work one way, where the insurance company takes your premiums every single month and then suddenly when you need them, deny. So can you give me some hard numbers on your successes here in this process?
You bet. Waystar serves over 1 million providers across all the different care settings. We're processing over 6 billion insurance transactions each and every year as we help providers and bring fairness, and we advocate for providers and patients as they interact with insurance companies. In January of this year, we launched a first-of-its-kind generative AI solution called Altitude AI. It's a comprehensive suite of Gen AI capabilities that sit on the Waystar software platform to prevent denials and then to help providers rapidly follow up and appeal those denials. Let me give you a couple stats. On the denial prevention side, we're in a work that takes sometimes 3 days to successfully submit a claim. we're compressing that to 3 minutes using generative AI
Really?
on the Waystar software platform. So we're reducing manual work, we're improving connection rates and first pass claim acceptance rates to the payers. And then in the event that a claim does get denied, well, Waystar goes right to work for providers and for patients. And using Gen AI again, in that use case, we're compressing the time it takes for a provider using Waystar Altitude AI by 70%. We're autonomously generating appeal letters, gathering appropriate clinical and administrative documentation on behalf of that patient, and then we're helping to submit that appeal letter on behalf of the provider, and we're seeing remarkably successful overturn rates to help appeal those denied claims. So we're getting started, and we're excited about our mission to help providers operate efficiently and spend more time focused on patient care.
Yeah, how about that? Matthew, good work. Congratulations to the company. And as we continue to watch the stock, we'd like you to come back, because I am sure the insurers aren't too thrilled about these overturned claims, but we think it's important because the number one reason for personal bankruptcy in this country is medical debt. And that is not a good thing. That is not a good thing. Thank you so much for joining us.
Waystar is here to help. Thank you. Nice to visit with you.